Post-traumatic stress disorder, PTSD, is a mental health condition that can develop after experiencing or witnessing a traumatic event. For veterans, PTSD often stems from exposure to the horrors of war, including combat, assault, or disaster relief efforts during their military service. Symptoms of PTSD can be debilitating, ranging from flashbacks and nightmares to anxiety, depression, and social isolation. Fortunately, the Department of Veterans Affairs, VA, provides critical support and services to help veterans manage and recover from this condition. One of the primary ways the VA assists veterans with PTSD is through its comprehensive mental health services. The VA offers individual and group therapy sessions, evidence-based treatments like cognitive processing therapy and prolonged exposure therapy, and medication management to help alleviate PTSD symptoms. These services are provided by trained mental health professionals who specialize in working with veterans and military-related trauma. The VA also offers specialized PTSD programs for veterans who require more intensive support. The PTSD Residential Rehabilitation Program provides a structured, therapeutic environment where veterans can focus on their recovery while receiving round-the-clock care. Intensive outpatient programs allow veterans to receive comprehensive treatment while still living at home and maintaining their daily routines. Additionally, vet centers across the country offer free confidential counseling and readjustment services for veterans and their families in a non-clinical setting. For veterans in acute distress, the VA operates the Veterans Crisis Line, a 24/7 hotline that provides immediate support and crisis intervention. Trained responders help veterans in emotional crisis, offering reassurance, coping strategies, and connections to ongoing care. The VA also provides monthly tax-free disability compensation to veterans whose PTSD is connected to their military service, helping to offset the financial burden of managing this condition. In addition to traditional therapies, some VA facilities offer complementary and alternative treatments for PTSD. These may include yoga, meditation, acupuncture, and art therapy, which can help veterans manage stress, improve emotional regulation, and foster a sense of inner peace. While more research is needed to fully establish the effectiveness of these approaches, many veterans report finding them helpful in their recovery journey. It is important to note that PTSD is a highly treatable condition, and recovery is possible with proper intervention and support. However, seeking help can be difficult due to stigma, lack of awareness, or access barriers. The VA has made significant strides in expanding mental health services and reducing wait times, but ongoing challenges remain in ensuring all veterans receive timely, high-quality care. In conclusion, the VA plays a vital role in supporting veterans with PTSD through a range of therapeutic interventions, specialized programs, and crisis support services. While the VA has demonstrated a strong commitment to meeting the mental health needs of veterans, continued efforts are necessary to enhance access, reduce barriers to care, and explore innovative treatment approaches. By prioritizing the well-being of our nation's heroes and providing the support they need to heal from the wounds of war, we can help veterans with PTSD reclaim their lives and thrive in their post-military journeys. Building on the important work already being done, there are several ways the VA could further enhance its PTSD programs and services. One key area for improvement is increasing outreach and education efforts to raise awareness about PTSD and the available resources. Many veterans may not realize they are experiencing symptoms of PTSD, or may be hesitant to seek help due to stigma or cultural barriers. By partnering with veteran service organizations, community groups, and healthcare providers, the VA can work to dispel myths about mental health treatment and encourage more veterans to access care. Another potential avenue for growth is expanding telehealth services for veterans with PTSD. Telehealth allows veterans to receive therapy and support remotely, which can be particularly beneficial for those living in rural areas or with mobility limitations. The VA has made significant investments in telehealth infrastructure in recent years, but continued expansion and refinement of these services could help reach even more veterans in need. The VA could also benefit from increased funding and resources to hire additional mental health professionals and reduce wait times for treatment. While the VA has made progress in this area, staffing shortages and high demand for services can still lead to delays in care. By advocating for robust funding and implementing innovative staffing models such as peer support specialists and community partnerships, the VA can work to ensure timely access to PTSD treatment for all veterans. Finally, the VA should continue to invest in research to improve our understanding of PTSD and develop new, evidence-based treatments. This includes studying the long-term effects of PTSD, identifying risk and protective factors, and exploring the potential of emerging therapies such as MDMA-assisted psychotherapy and virtual reality exposure therapy. By staying at the forefront of PTSD research and treatment innovation, the VA can provide veterans with the most effective and cutting-edge care available. The VA has made significant strides in supporting veterans with PTSD, but there is always room for improvement. By enhancing outreach and education, expanding telehealth services, increasing staffing and resources, and investing in research and innovation, the VA can continue to provide the highest quality care to our nation's heroes. With ongoing commitment and support, we can help veterans with PTSD heal, recover, and build fulfilling lives after their service.